A. Young et al., 2015, was done in a clinical setting. The results concluded that median length of stay was 76.6 hours in the pre-pathway cohort compared to 56.1 hours compared in the post-pathway cohort. By the end of post-operative day number 2, 40% of the post-pathway cohort remained in the hospital compared to 87% of the pre-pathway cohorts. Chen et al. 2012 study was done in an acute clinical setting. Patients who received therapy on post-op day number 0 stayed an average of 2.81 plus or minus 0.77 days, and those who received therapy on post-op day number 1 stayed an average of 3.79 plus or minus 1.74 days. The length of stay was significantly different between the groups. Guerra et al. 2014 study was done in an acute hospital setting. The results concluded that 5 randomized controlled trials were included for review. A meta-analysis of 5 trials found a reduced length of stay of 1.8 days in favor of the experimental group. In 4 of the 5 trials, the experimental group first sat out of bed within 24 hours post-operatively. In 4 of the 5 trials, the experimental group first walked within 48 hours post-operatively. The individual trials reported benefits in range of motion, muscle strength, and health quality related quality of life in favor of the experimental group. Okamoto et al. 2016 was done in an acute care setting. The results concluded that early mobilization group was ready for discharge 63 hours after surgery compared to 70 hours for the control group. However, there was no significant difference in hospital stay in the early mobilization group. Finally, Webster et al. 2004 was done in a specialized orthopedic center in Ontario, Canada. The results concluded that they identified guidance from physical therapists as an important component of their recovery, but sometimes they had difficulty arranging physical therapy after hospital discharge following their most recent surgery.